assisting our operations at the health department and our vaccine distribution. We received an incredible response from folks in our community offering their volunteer services, whether it's traffic control, registration, or clinical services. Putting on regular vaccination clinics is a mammoth undertaking, and all these folks are critical to making sure that it goes smoothly. Additionally, we have seen great generosity from folks who are regularly dropping off food to those who work at these clinics. It has been wonderful to see such random acts of kindness happening in this way, so thank you. We have received several questions about our wait list and wanted to spend a few minutes clarifying how it works. Our wait list is a living list, and what that means is that anyone who qualifies based on current phase requirements can sign up for our wait list at any time. Right now, there are more than 19,500 people signed up on the list. Because the demand for this vaccine continues to greatly outpace the supply, it will take time to work through this list, so we continue to ask for patience. As we have vaccine available, we are reaching out to folks on our wait list in the order in which they appear on the list to schedule an appointment. When we reach out, folks will receive a text message instructing them to sign up for a specific vaccine opportunity. If the text can't be delivered, an automated phone call is placed with instructions on how to register for an appointment. If no one answers the call, a message is left on your voicemail. It is important that when you receive this text message or phone call, that you respond and confirm your appointment in a timely manner, because if we don't hear from you, we will be forced to move to the next individual in line. If you have already received your vaccine elsewhere, there will be instructions on how you can remove your name from the wait list. We are happy when folks are able to find alternate vaccination opportunities. We just hope that and ask that you please let us know so we can take your name off the list. It slows down our process greatly to have to reach out multiple times to individuals to confirm an appointment, only to find out that they no longer have a need for one. And if you are on multiple lists for vaccine providers across the community, all of this applies to all of them as well. Please be as responsive as possible to these calls that are coming in, texts that come to you, so that we can get you signed up or they can get you signed up. And please also let those other vaccine providers that have you on their wait list know if you've found another opportunity as well, so they can remove you. As we have mentioned, when folks sign up for our wait list, they are agreeing to allow us to share information with other vaccine providers in our community. That said, we want to be very clear that this is our wait list, Knox County Health Department's wait list. It is not a community wait list. Other vaccine providers across the community have other processes in place to register and schedule their appointments. And however, sometimes they have extra slots available or having trouble filling their slots. They will reach out to us and we will pull people from our wait list to help fill those available slots. But we want to be clear again, this wait list is primarily for KCHD's vaccine opportunities through the health department. It is not a wait list for all of our community vaccine providers. So we just want to make sure that was clear with everybody. We want to urge people who are eligible to receive this vaccine to look at all of the options that are out there that exist in Knox County to get a vaccine. A great place to do this is through CDC's new Vaccine Finder website. We have this link on our vaccine information page, and I think we're showing it to you right now. You can type your location or zip code, and from there you can reach out to those organizations that are listed to find out more about how they are scheduling appointments. And we encourage folks to do that. We are encouraged that more access points are coming online for folks to receive this much desired protection. We eagerly anticipate this availability to continue to expand in the coming weeks and months. In Knox County, just as a reminder, those 65 and older and those in the first 3 priority groups, including healthcare workers, childcare staff, and K through 12 teachers and staff, are eligible to receive the vaccine. And now we'll move on to the local situation. We have 52 new confirmed cases since yesterday's report. 1,464 of those are active cases. 52 Knox County residents are currently hospitalized. And sadly, we have 1 additional death to report today, raising our total to 531. And now we'll move to the benchmarks. All of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. So moving on to our first benchmark, sustained reduction or stability in new cases for 14 days. Over this time period, we saw daily new cases drop to approximately 91 cases per day, down from the previous reporting period, which was around 120. The average number of cases over the past 7 days was 67. This is a lower average than we've seen in months. We have continued to see this number fall over the past month, which is extremely encouraging and something that we hope to see continue. However, we want to stress that COVID-19 is still very present in our community, and everyone must continue to practice the 5 core actions to ensure that our case count doesn't see another upward climb. Because of these factors, we are representing this benchmark as a cautious green. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding testing, we continue to see this figure trend down. As we've continued to say, we are hopeful that this is an indication of a lower burden of disease across the community, but we will continue to keep a close eye on it. We do continue to urge everyone and anyone who has symptoms or has been exposed to COVID-19 to please get tested. Regarding lab turnaround time, this number continues to be consistent at less than 1.5 days for the community. Because of these factors, we are representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. The goal is to increase vaccine distribution across Knox County. For this benchmark, we are looking at the full public health system, not just Knox County Health Department, but also all of our community healthcare partners. The graph on this benchmark will be used to show trends related to vaccine administration by provider. We are working to build standard deviations into this data so we can more specifically talk about the trends. However, as you can see from the graph, vaccine distribution does continue to trend in the right direction across the community. We did experience a slight dip in vaccines distributed over the past week, but we want to make sure everybody knows that not all the vaccine efforts have been documented during that time yet. So that number might go up. This week, we are representing this benchmark as yellow. We are heading in the right direction, but we recognize the demand for this vaccine continues to drastically outpace the supply. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this time period, we have continued to see hospitalization numbers decrease. This is encouraging and something that we hope to see. After speaking with our hospital partners, they have recommended that this benchmark be represented as green. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. During this time period, we have seen 27 deaths associated with COVID-19, which is down from 32 last week. Since the beginning of the year, there have been an average of 4 deaths per day, but an average of 1.9 deaths a day over the past 14 days. This does indicate that it's trending in the right direction, but we do want to see it continue. The information available leads us to represent this benchmark as yellow. And then under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of yesterday, our 14-day trend line shows 17 new cases per 100,000, and our 7-day trend line shows 14 new cases per 100,000, which is down from last week. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health, and the 7-day average for percent positive in Knox County is 13.57%, which is slightly down from last week. With that, I'll now open it up for questions.
All right, and as a reminder, you may type your questions into the chat feature. The first question we have in from our media partners is from Brian Hornback. How many minutes do you allow someone to contact you back after a text or a call?
It's
for the wait list. And it's not minutes, it's hours.
Yes, several hours.
From Vincent with Knox News. Last night at the Board of Health meeting, Dr. Gocher mentioned that the new cases benchmark had last been green at the end of September. I just wanted to confirm whether that was the last time the benchmark was green.
You know, Vincent, I'd have to go back and look at it myself. I don't have that information in my head. We'll have to follow up.
Yeah, we can follow up. Any further questions? Please go ahead and submit them. see. Also from Vincent with Knox News, could you follow up with the monthly death totals by date of death? And yes, we can do that as well. Any further questions? Please go ahead and submit them. All right. Austin says he is typing.
All right.
So we will wait for that. Get you some music.
I really feel like we need music during these times.
All right, while Austin is typing, if anyone else has any questions, please go ahead and submit them now. Let's see, from David with WVLT, why is the Knox County Health Department reporting 531 deaths when the Tennessee Department of Health is reporting 571 deaths? What number is accurate?
We're actually working through with our team. We noticed that as well. And our team's working with the state to make sure that we can get on the same page. We think that a lot of these that just recently came in are from the state cleaning their data and getting through all the reports from the large backlog of cases that came in December and January timeframe. And sadly with that, there were a lot of deaths. So they're working through their process. And so we're working through ours as well with them. And we'll end up with more information on that coming soon.
From Brian Hornback, with the Board of Health going to monthly meetings, are we on the end of the pandemic?
I don't know that we're on the end of the pandemic, but I think that that's an indication that things are moving in the right direction. We're seeing our case count move in the right direction. We're seeing vaccine going up. And so the pace is a little different at this point in time. But we are absolutely not at the end of the pandemic where we can let loose and stop doing and following the 5 core actions. We want to still encourage everyone to do that so that we can keep the momentum moving forward that we have right now.
From Austin with WATE, does the number of people on the wait list for vaccine have any effect on the number of vaccines KCHD can request?
It does not. That's a completely separate calculation from the state.
From Vincent with Knox News, do you have further comment about the state of benchmarks relative to the pandemic in the community?
Oh, that's broad. We are very happy with the direction that we're going. They have been moving in the right direction. We wanted to see that happen for at least 2 incubation periods. So we've looked at that for more than 28 days. And we're seeing those trends continue, which is a good sign. And I think it's a good sign that there's a lot of positive things happening. So we've already mentioned vaccine. I think a lot of people are still following the 5 core actions and doing all the things that we need to do to keep us moving forward. So I think it's something to be encouraged about. I think it's something to be hopeful about. And we really just want to, keep our foot on the gas moving forward.
Also from Vincent with Knox News, ultimately the goal is to get cases and deaths back down to before COVID-19 became prevalent in the community, correct? What does that look like?
The Board of Health, I think COVID-19 is not going to go away completely. I think that it's going to be out there. And so we need to kind of keep that expectation there, but it needs to be at a manageable level. And the Board of Health has set some parameters around that with the new cases per day and our percent positivity and getting those both of those things down below 5. So 5 new cases per day and below 5%. 5. Yes. Yes, sorry, I didn't say the rest of it. 5 per 100,000, sorry. Not 5 total, 5 per 100,000. And then the positivity rate below 5%. That's really where we would start feeling much better about where we are as a community overall in the pandemic.
From Austin with WATE, we're hearing that professors at college level are not eligible for the vaccine in this phase. Is this true? And is there work being done to include them?
That is true. And I would refer those questions to the State Department of Health as they're who set the priority groups for the vaccine.
From Vincent with Knox News, when it's at a manageable level, is that the point at which KCHD would reattempt contact tracing? And what changes do you anticipate on your end once we get below those levels?
That's a good question. We've actually, given our lower case counts and our capacity at this time, we've actually started implementing some more contact tracing over the past week or so. And so we will continue to work on doing that as we move forward. It's really scalable with our team. And so what we are doing again is asking for our cases. We're still interviewing all of our cases. We are then now asking them for their contacts and getting those into the state system to be notified in the contact tracing process. So we are very happy that we've been able to get back into that business given the volume of cases that we have.
From Claire from UOT, it appears that pending COVID lab rate for hospital inpatients is at the highest it's been since early December. Does this indicate anything concerning?
I would ask the hospitals that question. I really can't address that one.
Any further questions? Please go ahead and submit them now. All right, I'm not seeing any other questions trickle in. So thank you all for your time today. And we hope you have a great and safe weekend, and we will see you again next week.